now is the best time, no, to look deeper into the social determinants of health, to make policy changes in order to improve the situation of our people, to address the social determinants. And that means ayusin yung employment, no? Ayusin yung landlessness ng ating mga magsasaka, ayusin yung education, ayusin yung housing situations ng ating mga kababayan para masigurado natin na ma-improve din yung health ng ating mga kababayan and yung pandemic response mismo.
Ito ang Baryo Tanyong, isang baryo na malapit sa estero ng Malabon. May laking 5 ektarya na kung saan may humigit kumulang na 850 pamilya o 6,000 katao ang nakatira. Dito sa Baryo Tanyong, nakatira ang mag-asawang Jaime, 24 na taong gulang, at Lucy, 27 taong gulang, pati na ang kanilang mga anak, sina Antonio, 8 taon, Jose, 5 taon, Marites, 4 na taon, at Rosario, 8 buwan.
Family planning.
Isa si Jaime sa mga galing sa probinsya na lumuwas sa Maynila. Ang kanyang pamilya ay taga Pangasinan. Isang maliit na magsasaka ang kanyang ama.
Environmental health.
Hindi na nakasapat ang ani ng kanyang ama kaya't nagpunta ang kanilang pamilya sa Maynila. Ngayon, si Jaime ay isang manggagawa sa isang talyer sa Malabon. Kumikita siya ng 50 piso isang araw, subalit ito'y kulang pa rin sa kanyang pamilya.
Kwento ni Rosario may be a bit old and the circumstances also, no, parang lumang-luma na, but up to this day, this situation is still true, no? For many of our kababayans. They are still living in depressed communities, and the reasons why they came here to Manila, most of the informal sectors are almost the same reasons, no? Bakit umalis yung tatay ni Rosario sa kanila way back, no? In, I think this setting was in the 80s.
Ang pinakamasakitin sa kanila ay ang bunsong si Rosario. Siya ang pinakapayat, pinakamaputla, at palaging nagtatae. Isang araw, si Rosario ay nagkasakit ng tigdas. Dinala siya sa malapit na health center kung saan niresetahan siya ng Mucolex.
Just like COVID.
34 na piso ang halaga. Keflex, 57 piso. At guanamycin, 24 na piso. Nang maubos na ang tigi-isang bote ng 3 gamot, ay hindi na nakabili ang mga magulang ni Rosario dahil wala na silang pera. Hindi siya tuluyang gumaling, patuloy siyang nagtae hanggang matuyuan ng tubig sa katawan.
First, very striking ang environment and a lack of environmental health, no, in the video. The surroundings, very striking, a lack of water sanitation and hygiene that actually promote illnesses, no, like diarrheal diseases. And we see very clearly the impact of poor wash, poor environmental health on the health of the child, no, who actually lost her life. And when you talk about environmental health, hindi yan diagnosis and treatment. Hindi yan medical doctor. No, we need to look into expertise in environmental health. Environmental health is a major determinant, no, of health versus illness, no, and disease.
So as practitioner, as a doctor and specialist community doctor, We have seen so many cases like Rosario. I've been practicing for 20 years already, and every year, no, marami kaming ganyan talagang cases na nakikita na yung parents are not really well informed and educated about health problems, and since they always have financial problems, mas lumalala yung sakit ng kanilang mga anak. And up to the point, no, na talagang kagaya ni Rosario, talagang kumikitil ng buhay. Yung mga simple na mga sakit na supposedly kayang-kaya na nating gamutin at this age and time. Ang pagtatae, ang higdas, no, ay alam na alam nating gamutin. Pero hanggang ngayon, sadly, namamatayan pa rin tayo dahil dun sa mga simpleng sakit na yun. At hanggang ngayon, yan pa rin yung mga nangunguna, no, or part ng top 10 mortality or sanhi ng pagkamatay ng mga mga kabataan natin sa Pilipinas.
The poverty is striking, and poverty vis-a-vis health, illness, disease, closely intertwined. Being poor actually makes you prone to illness and disease. And illness and disease actually pushes you further into poverty. It's a vicious cycle. So which came first? No, you don't know which came first. But it's actually one major factor affecting the other. A vicious cycle of poverty, illness, disease.
There is a misunderstanding on the term political. Sinasabi ko lagi na baka ibig sabihin ng mga tao is health is non-partisan. In other words, hindi ka dapat kumakampi, kumikiling sa kahit na ano. I mean, ano ba yung sinusumpaan sa Hippocratic Oath, di ba? Hindi mo papansinin kung ano yung paniniwala ng pasyente. Hindi mo rin sasabihin sa kanya kung ano yung paniniwala mo. Hindi mo i-impose sa kanya. Pero hindi ibig sabihin wala kang paniniwala. Hindi ibig sabihin wala kang politika. May politika ka at by extension, health is political. Kasi ang lahat ng mga serbisyo, yung clinic mo, di ba? Saan ka ba kukuha ng permit? Sa local government unit. Saan ka nagbabayad ng professional tax receipt, PTR? Sa local government unit, sa mayor mo, sa mayor's office. Saan ka kukuha ng lisensya? Sa Professional Regulation Commission na isang kumbaga bahagi ng pamahalaan. At sino nagpapatakbo sa pamahalaan? Di ba? Isang politiko na inihalal ng mga tao. So lahat tayo ay kumikilos sa loob ng isang sistema, isang system na sinasabi na political. So it is patently inaccurate and intellectually dishonest to say that health is not political. Kasi nga politics runs the whole system. Maybe what should be said is health is non-partisan. Hindi tayo kumikiling or kumakampi sa kahit na ano kasi lahat pinapagaling natin.
I think it's a misconception that health is not political because health is affected by the social factors, which are influenced or if not totally driven by politics in play. These are called the social determinants of health that we know. Social determinants of health are non-medical factors which affect the health outcomes of the people. So, we should always go back dun sa definition natin ng health. According to WHO, health is not just mere absence of disease, but yung complete or total well-being ng ating physical, mental, and social. So, and of course, I also I'm a staunch advocate of the Alma Ata, the primary healthcare, na ang principle ay ang kalusugan, health is a basic human rights, and we as the healthcare provider are duty-bound to uphold these rights. And in upholding these rights, we have the responsibility to address or to help address the issues that affects the health of the people. Itong mga sakit na to, pag hindi natin na-address yung root causes ng pagkakasakit nila, then it will be a vicious cycle ng ibabalik mo lang siya no, dun sa pinaka-sitwasyon which causes na yung pagkakasakit niya. And then it will be a vicious cycle na magkakasakit siya, babalik sa'yo until kagaya ni Rosario, no? In the end, mamamatay din ng ating mga kababayan.
Think about it two ways. No, talagang health should be the least political. No? Health should be apolitical. Unfortunately, in this country today, health is politicized. No, you put a politician in the Department of Health as the leader of the health sector of the Republic of the Philippines, we are in deep trouble. And we experienced that trouble up to now. No, we deserve something better than what we're experiencing now as far as public health is concerned in this country. No, so yes, health should be apolitical, but unfortunately the government treats it or demonstrates it as something political. Even if they deny it, we can feel it. You can say it is not like this, but the way we see it, the way we feel it, it is really political. All right. On the other hand, I like to see it as a political, and therefore you should not put a politician as the head of the health sector in the whole Philippines. No, there in the DOH. No, hopefully in the new government, there's going to be a less political and apolitical person being put there, because health is universal. Now, who deserves to be given the health services? Who deserves health? It's everybody. Whether you are colored or not colored, whether you are poor or rich, whether you live far or you live near, you need all the guarantees of universal health care. Okay? And one of them is access, where you also do not go broke because of illness, where your poverty does not prevent you from getting the kind of health care that you need. Okay, so it's all on paper, it's all in the law, the Universal Healthcare Law. Unfortunately, the government is unable to keep its promise of providing universal healthcare for all. No, so tama, no? Health should be apolitical, but the government doesn't seem to demonstrate that, and therefore we have to approach the kind of situation where, everybody feels included as far as health is concerned.
I think we should not disregard itong social determinants of health, and we should be able to ensure that we address itong social determinants. Examples yung financial, employment, diba? Education, housing status, food security, discrimination, and access to healthcare. These are very important factors, no, which determines the health of our people. Kaya ang gusto natin is to prevent the diseases from occurring to our people. So that means, no, as doctors, as healthcare professionals, beyond treatment ng mga sakit, we should prevent this, and we should be able to advocate, involve ourselves in governance, policy making to ensure now that these problems will be addressed.
So much. No, an illness always has a social component. No, if you want, it said socio-economic component, no, of health and wellness, or the other way around, socio-economic components or aspects of disease, illness and disease, or being not healthy. No, always intertwined. No, hindi mo siya mahihiwalay. So, and all of us have a certain role to play. First and foremost dito, gobyerno. Ang laki ng role ng gobyerno dito because the government sets the tone, sets the direction. And in fact, the government is ideally should be focused on those who have the least, on those who are last, on those who are lost. No, so I think it's a good time because government is going to be changed very soon, and we're very hopeful that with the new government and with new health leadership, public health leadership, some of these things can be surface. And actually, we now try to address the remaining kinks in the public health system in the Philippines that is so deeply rooted on the social determinants, include the economics overgap.
Well, alam nyo kasi yung, di ba, meron tayong kasabihan sa medical training, sa medical school, yung clinical eye, di ba? Yung papasok pa lang yung pasyente, meron ka nang iniisip, pinaprofile mo na siya na yung gait niya, yung lakad niya, o yung nutritional status niya, makita mo na parang kakektik yata siya or parang overnourished or undernourished, ganyan, di ba? Yung makikita mo yung pallor, namumutla ba siya or parang hyperpigmented ba yung balat, mukha ba siya nagda-dialysis. Ganoon rin sa public health eh. Pag play nung video, parang karamihan ng mga tao will be drawn dun sa music. Nakakaawa naman, di ba? Si Rosario, ganyan-ganyan. Pag public health practitioner ka na, oo, may awa ka rin, pero just like any other clinician, if you are looking at the patient, hindi ka nakatingin lang dun sa mata, dun sa bibig, dun sa dibdib. Nagsascan ka na eh. So all of the factors, at least in that video, which is of course curated, ibig sabihin, dinirect yan, di ba? May-script yan, meron silang pinapakita, ma-identify mo na. So, yun, para sa akin, all of those factors have to be considered all together. Hindi yung titingin ka lang sa isang bagay.
So, I think health must tap on the other sectors to actually influence how public health goes henceforth as our way forward. For instance, I think this was started by the previous governments, talagang connecting it with social welfare and development, yung ating 4 Ps that actually promote education and additional support for those who are in the poorest of the poor, etc., etc. Na hindi lang siya pagpapaganda ng health center or to ensure that merong gamot sa health center. Talagang it's a massive type of undertaking that entails a lot of investments. So in other words, it's addressing the problem of health in various levels across the different sectors, with other sectors coming in. We're so dependent on foreign funding when in fact, if we earn the resources, we have a very good economy, let it be felt in the kind of programs that we offer our people. We hear about the economies, gap, sinasabi, gaganda ang indices and all that, pwede bang maramdaman yan sa health sector? So that hindi na mangyayari na walang pera, kaya hindi ma-admit. O kaya hindi siya maaabot ng health services kasi malayo siya doon sa health center. Okay, so in other words, talagang pasok yan. Na hindi lang po health yan, economics na po yan, na pati sa health mararamdaman. Social welfare and development, pati sa health mararamdaman. Education, pati sa health mararamdaman. Ito na po yung intersectoral collaboration na ideally, sino magkukumpas ng mga yan? Yung presidente po ng Republika ng Pilipinas.
Since yung pandemic kasi only has exposed the flaws in the problems of the health systems and society in general. It also unmasked yung inequities in health. The social determinants has deteriorated because of the pandemic. So, I think this is the best time. Kung meron mang positive, kasi we always want to look at the positive side of kahit yung mga problems, di ba? That is that I think people in the government realize yung mga problemang ito kasi na-expose na siya. So that social determinants approach should be integrated into the pandemic response, pandemic prevention, preparedness, response, and recovery. Hindi na pwedeng health lang, okay? Health sector lang yung i-address natin because this pandemic is not just about the health sector, as according to the WHO. Social determinants of health actually accounts for around 30 to 55% of the health outcomes. Ibig sabihin, we can attribute the health status of our people. Half of it is attributable to the situation, no, economic and social situations. Now is the best time, no, to look deeper into the social determinants of health, to make policy changes in order to improve the situation of our people and to address the social determinants. And that means ayusin yung employment, no? Ayusin yung landlessness ng ating mga magsasaka para wala ng mga kagaya ni Efren, no? Na talagang lumuluwas pa at hanap ng ibang hanap buhay na kakarampot naman ng kita. Ayusin yung education, ayusin yung housing situations ng ating mga kababayan. So, those factors, no, ang gusto nating i-improve para masigurado natin na ma-improve din yung health ng ating mga kababayan and yung pandemic response mismo.
Marami sa mga social determinants ang naging dahilan kung bakit ganito yung nangyayari sa atin ngayon sa pandemya. By research ngayon, alam na natin na COVID is airborne, no? It's just like measles. Tingnan mo yung kwento ni Rosario, 'di ba? Yung unang na-pick up ko doon na sinabi siya ay nagkaroon ng tigtas, airborne. 'Di ba? So why am I saying this? Parang nagugulat pa ba tayo? Bakit nagkakaroon tayo ng mataas na case count ng COVID? I mean, hello, tignan mo yung measles, nag-outbreak tayo bago pa mag-pandemya. Nakailang outbreak tayo. Kung makikita nyo historically, yung in recent history, no, 2012, 2013, biglang nag-a-alarm yung DOH. Meron tayong outbreak ng measles. Pero bakit tayo hindi kinakabahan sa outbreak ng measles? Kasi may bakuna. May bakuna. So, parang dinidismiss siya ng tao na bakunado naman ako, which reflects another parang issue sa natin, no, yung inequity. Kasi hindi pantay yung mga unang nababakunahan, yung mga may access sa bakuna, nabibigyan or naniniwala, usually nasa, again, social determinants, higher income brackets, better educated, mas maganda yung bahay. Paano mo sasabihin mag-isolate? Sasabihin mo, 1 meter apart. Titingin sa'yo yung pasyente, yung pamilya. Ang barong-barong kasi namin, 1.5 by 1.5 meters lang tatlo kami, 4 kami. So, parang mahirap yata yung math nun, no? Parang pag ginawa mo kaming 1 meter apart, paano kami mag-1 meter apart? Number 1. O sasabihin mo, kailangan, ngayon, iba na usapin ngayon kailangan naka N95, KN95. Magkano ba ang isang KN95? Nasa yung rig, nasa 150 to 200 pesos. Magkano ba minimum wage sa Metro Manila? Nasa 500. Nagbibigay ba ng minimum wage yung mga yung mga employers sa factories, etc. 'Di ba? Plus meron pang ibang gastusin, may pagkain, may renta dun sa kahit barong-barong may renta na ngayon, 'di ba? May upa yan. So, if you notice, I'm not even talking about government's response. I'm talking about the situation, the social determinants surrounding families who are susceptible, diba, epidemiologic term, susceptible to the virus. And the virus does not care, diba? The virus does not care kung anong strategy mo, kung anong politika mo. So ang sinasabi ko is parang walang pakialam yung virus. Ang pakialam ng virus is, magkakalapit kayo sa bahay. Sige, hawa kayong lahat, di ba? Wala siyang pakialam kung sinong binoto mo. So, social determinants. Now, this is where it becomes connected to politics. Parang, paano ba ayusin yung social determinants? Hindi yan naaayos overnight Development yung nag-aayos niyan. So, what am I trying to say? Pandemic response does not begin when you discover the first case of a new pathogen. It begins long before that. It begins through preparation of your entire health system, and not just your health system, but also other connected systems.
Okay, naniniwala ako na mga nagme-medical student, karamihan, most if not all, are really good people. Because kagustuhan mong magpagaling ng tao Gusto mong maging healer ng mga tao. And therefore it needs the highest level of human capacity to help each other. Para bang ang taas-taas ng requirement. And therefore pag nagdoktor ka, natanggap ka sa magagandang eskwelahan, ibig sabihin magaling kang tao. Now, kung magaling kang tao, saan mo dadalhin ang galing mo as a future physician? Okay? Or saan mo gagaling? Gumraduate ka na sa magaling na medical school, saan mo dadalhin ngayon ang pagdodoktor mo? Okay, madaling-madali. Tingnan mo ang mga teacher mo na nag-lecture sa inyo at saan ka natuwa, saan ka na-impress, and then you'd like to be like the teacher. Unfortunately, ako'y nalulungkot no? Kasi ang pinaka quote-unquote glamorous sa kanilang lahat, siyempre yung mga dumadating na naka-white coat, na naka-kurbata, naka-Amerikana, tapos kukwentuhan kayo about malaki ang kita dito sa specialty nito at maganda ang opisina ko, etc. etc. That's the glamour part of medicine. But there are undersubscribed areas of medical practice that possibly the future doctors can look into. Ano yung sabihin ng undersubscribed? Hindi siya popular. Okay? Undersubscribed siya kasi kulang pa ng ganong klaseng doktor sa Pilipinas. And therefore, when you choose something like that, something that is not popular pero kailangan pala siya, then you realize the value of your being a good person and being a good physician. We have to take a look also at the distribution of these specialties. Kung doon kayo magpa-practice kung saan kulang, by all means do it. Pero kung makikipagsiksikan ka dito na madami ng klaseng ganyan, bahala ka. Compete, matira, matibay. But for those who are more adventurous, for those who are more socially inclined, looking into more socially relevant disciplines, look into the undersubscribed specialties in the future. Now, it may not be enough to just get a medical degree. Ang ginagawa ng ating mga doctors of the barrios, they do their Master of Public Health here in the UP College of Public Health with College of Medicine. We graduated our first batch of 155 last year. We have about 150 this year. Kasi ang public health, hindi po siya natututunan sa College of Medicine lang. It's a discipline, a specialty, a legitimate one, and you need further training in public health. Hindi po siya nakukuha lang sa medicine. But rather, you do further studies here or overseas.
Look beyond yung nakikita natin health status. But yun nga, to approach yung healthcare ng biopsychosocial, we go beyond the disease, but the situation also ng patients, the context of our patients themselves, and siguro uphold yung right to health. Kasi pag yun yung naging guide natin, yung WHO na definition ng health, yung holistic na approach to health, and yun nga, kung holistic yung pagtingin natin, then we will see beyond and we can work more than those expectations nung society. I think you should be bold, Huwag tayo magpalimit dun sa exams at sa 4 na corners ng classroom in order to learn. Okay? Kasi I believe that learning takes place not just in the classroom, but more outside, more in the community.
The irony of the situation is, as medical students and future doctors, hence future doctors, we are all, ako, nasa side na ako ng doktor, we are all contributing to something which should not be the case when it comes to public health. What am I saying? Public health should not be medicalized. Anong ibig sabihin ng medicalized? Yung bang tipong ang tingin mo sa public health ay isang malaking panggagamot in the sense of curative care na ang solusyon lang lagi ay isang operasyon, ang solusyon ay isang gamot, ang solusyon ay ospital. Hindi ganoon ang public health. Public health is a organized, coordinated and organized effort of society to fix the conditions that result into disease, di ba? Curative care, medical care is part of the spectrum of interventions. It's towards the end, but even before that, you have preventive and promotive care. You have screening, you have diagnosis. And that for me is the essence of public health. Now, as medical students, what should you do? Should you just like give up your Williams, your sila ba yung mga sila Schwartz, ganyan, sila Harrisons? Hindi sila yung mga libro ng public health, but the only advantage I think that being a physician gives to a public health practitioner is we know the language, we know the interventions, we know what has to be done to fix diseases, but we should step out of our comfort zones. We should avoid medicalizing and para bang concluding that we are the solution. No. hindi doktor ang frontliner eh. Ang frontliner is yung pamilya in this pandemic. The frontliner is the family who is actually protecting the head of the family, the household, who is protecting the members of the family. When preventive measures are requested or parang ordered, so to speak, by the government to prevent the spread of a new variant, hindi naman doktor yung tumatakbo sa loob ng bahay at sinisiguradong nagsusuot kayo ng tamang mask, di ba? Nag-physical distancing, nagwo-wash ng hands. Hindi eh. It's the head of the household. So we should, again, to answer the question directly, we should not para bang think that doctors are the only solution. Rather, we should humble ourselves. We should be good. We should be excellent at our craft, but we should approach public health with humility and the readiness to collaborate, to work with other professionals, even non-professionals, basically the clients themselves, the patients themselves. No? Parang, because at the end of the day, it's all a coordinated effort. It is just a privilege granted to us that we are recognized as parang one of the foremost coordinators. But we should definitely yield to others if there is someone else or other persons or individuals or entities who are capable of delivering the necessary public health measures that are kumbaga needed for a particular disease.